Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Education Department approves over 600 classrooms for use in the COVID-19 fight. Also, the possibility of e-graduation rites, and yes, students' school reopening plans. Education Secretary Leonor Briones joins us live. Also, how soon can scientists find a cure for COVID-19 and the challenges of flattening the curve in the Philippines? We'll speak to genome expert Jeffrey Seitz later on the show. And a health worker uses syringe art to depict the country's battle against COVID-19, her tribute to Inang Bayan and fellow frontliners. For the first time since he was granted special powers to fight COVID-19, President Rodrigo Duterte did not address the nation on his weekly report to Congress, but he did send it out. But what's most striking about the report? It said of the 18 million beneficiaries of the government's cash aid, only 4 million have been served as of April 18. The Social Welfare Department says it's exploring other methods to fast-track the distribution of cash subsidies. The Information and Communications Technology Department is also finalizing a computer-based application called Relief Agad to speed up the disbursement. Of the total 246 billion pesos pooled savings as of April 16, nearly 149 billion has already been downloaded to relevant national government agencies. One of the concerns in this pandemic is where to put patients who need to be isolated or quarantined. The President's latest Bayanihan report did mention that the DepEd has approved 660 schools for use by local governments as isolation or quarantine areas. The President said requests for use of 324 other schools are still undergoing evaluation. Meantime, Senate Education Committee Chairman Win Gatchalian is calling for measures to ensure a safe reopening of classes. The senator says students, teachers, and other school personnel should be included in mass testing for COVID-19. Let's go straight to the source of the story. We have Education Secretary Leonor Briones. Secretary Briones, it's good to see you and it's good to know you're well.
It's good to see you also virtually. Finally, COVID brought us together because we have had difficulty arranging our interviews.
It sure did, Secretary Briones. Let me start with this. Graduation rites for school year 2019 to 2020 was supposed to take place around the month of April, but an advisory from the DepEd says these are postponed indefinitely. So what will happen now? And do the students need to have some sort of graduation rites?
Some regions have expressed the desire to have e-graduations, and our answer is if they comply with the very stringent requirements of the Department of Health, they can have e-graduation, but they will have to manage it very, very carefully because this is not the time to get careless. And as I have said, we have had earlier experiences when graduation was postponed, sometimes by a few months, sometimes by years, or sometimes even by decades. And it's not as if graduation rites are canceled. They are just postponed. And this is an event which parents really look forward to, sometimes even more than the graduates themselves.
Yeah, absolutely. It brings so much pride for the parents to see their children actually graduate. So this postponement, Secretary, just to be clear, is Luzon, Visayas, and Mindanao wide.
Yes. Kasi we cannot have one policy for one part of the country. It has to be for all because I think we are aware that in the Visayas and Mindanao, local governments have also declared lockdowns by themselves. So lahat-lahat na. Yung may kaya na mag-e-graduation sila, and for example, Davao is making such a request. We are evaluating it. Basta walang physical contact. Basta masunod yung lahat ng mga advice ng DOH. At saka virtual lang, the way we are looking at each other now. Wag na yung huge crowds which we usually associate with graduation.
Secretary, paano ho kaya yung e-graduation or online graduation? Because for that to happen, I'm assuming there are challenges such as, well, number one, internet connectivity, computers. Is this really possible?
Well, so far, only one region has made such a request, and this is Region 11 in Davao. And our answer to that is if they can manage it, because we also have a very strict IT team in the department, then they can go ahead. Although kung malaking batches, as you yourself said, it will really be quite interesting to see how they will manage an e-graduation with hundreds of graduates. Kasi senior high school ito eh. Malalaki yung mga batches ng senior high school.
Yeah.
Oo. Isa lang itong nag-request ng e-graduation.
So that's what I'm trying to say. So,
yeah, we share the same.
So, Secretary, para ang mangyayari po,
sabi nga nila, they're seeking for
ang
our...
mangyayari po,
Pardon?
Okay.
Pardon?
So ang mangyayari, for example, for those who want to propose secretary, they will have to implement their own online graduation, strictly following protocols of the Department of Health. So kumbaga sila na rin po ang bahala, basta't sundin nila yung safety measures in place.
At saka walang, kung baga sabi namin, walang face-to-face, walang physical activity. Dahil talagang very strict ang DOH niyan. Isa lang naman ang nag-request ng e-graduation. Kasi Pinky, earlier, mayroong ibang mga schools na nagpaaga sila ng graduation rites nila. Kaya hindi sila naabutan itong mga complications na ito. Pero ngayon, only one region has made such a request, and this is for Davao City. Yun nga, sabi namin.
Understand. Secretary?
Kung how they will manage that with hundreds of, and they are seeking daw the assistance of one of our, the biggest, one of the two biggest service providers in the country. How they will do it, they will have to show it to us as to how that can be
kailangan ng approval ng DepEd.
Yes.
Okay. Secretary Briones, ano pong mangyayari dun sa grades ng mga estudyante? Was there such a thing as should all students just get a passing mark? Nagkaroon ho ba ng mass promotion of some sorts? Sec?
We don't agree with the mass promotion because we don't have a policy of mass promotion. Pinky, nung una pang pag-declare ng community quarantine ng government, we already anticipated the problem. So we issued a memorandum kung paano i-compute yung mga grades, kung anong additional work kailangan ng mga bata. So that matter is already settled. Yung grades ng April pa, naayos na namin dahil nakita namin that it was forthcoming. So it's not an issue anymore.
Okay. Secretary, paano po, nagkaroon ho ba ng pagkakataon that some of the students may have had to do summer class and obviously such a thing cannot be implemented?
Kung may mga summer class, halimbawa dito sa Luzon, lockdown naman talaga tayo. It has to be online. It has to be by virtual communication. Kasi hindi naman masyadong problema halimbawa dito sa NCR or sa many parts of Luzon to get in touch with their students.
All right.
Nagde-develop na tayo. By the way, Pinky, we are already into yung sinasabi namin na continuity ng curriculum whatever happens, no? So, mayroon tayong website na tinatawag na DepEd Commons na lahat ng mga queries, lessons, tests, etc. ma-access ngayon more than 4 million na ang nagsa-subscribe and they access that. Pero para sa walang connectivity, we are looking at cell phones. Kung sa wala namang mga cellphone, we are looking at TV and radio na malayong-malayo. So we are moving in the direction na the educational process does not stop even as we have all these restrictions right now at this time of crisis.
Got it. Okay. Secretary Briones, let me go to school opening. Is there a plan on which month school will actually reopen?
We have been having nationwide consultations. I've had meetings with the executive committee, with a management committee as a whole na yan, buong bansa. And we have also consulted our external partners, businesses, education experts, etc. And the leaning is towards August for opening. Ngayon, we have to operate within the requirements of law. Ayon sa batas, we should open classes first week of June up to the last day of August. So yun ang window namin. Pero ang mukhang trend na lumalabas is really for August. But in the meantime, Pinky, I have to mention that AITF is now in the process also of making assessments in relation to ECQ. So whatever decisions or recommendations AITF will submit to the president will have an effect also on our graduation ceremonies. But the law is very clear. First week of June, last day of August, with a preference, very clearly declared preference for August. Whether it's last week, first week, we'll see how it goes.
And Secretary Briones, if it starts in August, because you said the trend looks like it's going to happen in August, ang mangyayari ho ba niyan, they will end school in May? Or dadagdagan na lang po ng oras at araw posible yung August na school opening para matapos po sila ng March or April?
Tama ka Pinky. Ang concern namin, gusto namin matapos din by March, but at the same time mag-comply ng number of days which is required by law for students to be learning. So kinoconsider namin ang possibility, for example, of Saturday classes, pero hindi yung mga face-to-face classes. They can do their work at home. And this is where we need the cooperation of parents, of yayas, of lolos, of lolas, in seeing to it or helping the children comply. Pero hindi kailangan na mapasok sila. Para hindi naman mabuboard yung mga bata to come on Saturday. So, ibang klase yung sinasabi natin ngayon, yung alternative delivery modes na ang tinitingnan natin. Hindi lamang yung face-to-face dahil sanay na sanay tayo dyan, pero mga paraan where the teachers can get in touch with their students largely virtually, tapos they can access the DepEd Commons. So, mababawi din namin yon sa bilangan ng araw kasi we have to follow the law of 180 days at least of really real school work for the children.
Yeah. It's just going to be extra work for the students so that they can finish sometime in March. I want to go, Secretary Briones, the president said that there were about 660 classrooms already approved by the DepEd for COVID-19. Is this the correct number? Because I'm also seeing that there are over 1,000 requests from the DepEd. And saan ho ba ito gagamitin?
Kasi request ito ng mga local governments na gawing stations for PUIs and PUMs, and we're very sensitive to the use of classrooms. So may mga standards kami. Kasi Pinky, not all classrooms, as you can see, even in your images, would be appropriate for PUIs and PUMs with the requirements of the Department of Health. So ang sabi namin, papayag lang kami when there is nowhere else to go. Hindi yung automatic na pag mayroong mga PUIs, dalhin ka agad sa eskwelahan. No. Ang preference is for big institutions, buildings, and so on. Last resort yan kasi the law is also very clear na hindi gamitin ang classrooms for purposes other than academic. Kaya very strict requirements, but at the same time, ito importante, Pinky, we require local governments who want to use schoolrooms to sign a memorandum of agreement with us. Na una, sabihin nilang wala na silang ibang puntahan. Eskwelahan na lang talaga. And they have to certify that under oath. Tapos, sabihin nila na they will be responsible for all the expenses. Kasi kapag gagawa ka ng isolation center or PUM center, kailangan, condition ito ng DOH, it has to be supervised by a medical person. And we don't have that kind of capacity na mag-check sa mga pasyente. Tapos, yung mga halimbawa, may mga masisira o kailangan mag-commit sila na kung hindi na gagamitin, talagang thorough cleaning because we don't want to risk our learners to virus hanging around the classrooms. So, commitment nila yon, but we ourselves will check it kasi magbibrigada eskwela kami. We have certain conditions which they have to fulfill. And it's not
comply with,
I think wala na silang ibang mapuntahan. Kasi yun ang sinabi sa batas na kung wala nang ibang mapuntahan under certain conditions, yes.
Okay. Education Secretary Leonor Briones, ma'am, it's good to see you virtually and stay well.
It's good to finally see you maski virtually. So wala na akong utang sa'yo.
Maraming salamat, Secretary Leonor Briones. Meantime, a nurse from Negros Occidental uses syringes to create art. Her latest work is a tribute to her fellow frontliners. We'll give you the details later. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Scientists all over the world are scrambling to find a cure and a vaccine for COVID-19, trying different approaches and medicines in treating patients with a deadly disease. The government says without a vaccine or a cure, Filipinos will have to live in the so-called new normal. This means even if the quarantine is lifted or modified, we'll have to maintain social distancing measures and even other steps to prevent the spread of the virus, which leads us to these questions. Are lockdowns effective? How close are we in finding a cure for COVID-19? Let's go straight to the source of the story. We have genomic scientist and Fix Genomics CEO Jeffrey Seitz. Mr. Seitz, welcome to the show.
Hello, Pinky. Thanks very much for having me. Magandang
Can
umaga.
you give us your assessment on how the Philippines... Magandang umaga po sa inyo. Can you give us an assessment on how the Philippines is faring so far in the fight against COVID-19?
Well, I think the president's done a pretty good job, all things considered. You know, we're living in an unprecedented time. It's so difficult to make decisions and make good decisions. So, you know, the president made a decision early on to restrict travel from various countries that were high in infection. He's put a lockdown on the country, an extended enhanced community quarantine, and I think all of those measures have had a great impact to save lives in the country. So overall, all things considered, I think the Philippines has done a reasonable job. One of the areas where there is ineffectiveness, and one of the areas where obviously I think there can be some improvement is on the testing and the contact tracing side.
Right. Yeah. When you talk about testing, the words mass testing have been used over and over again, not just in the Philippines, but all over the world. Would you be able to tell us what percentage of a population should mass testing exist? When and how many people or a percentage should individuals or the public be mass tested?
Well, you know, that's a variable that is different for every country, and it depends on not only the capacity to do testing, but also the healthcare infrastructure. If you look at the US, they are recommending anywhere from 20 to 30 million tests per day. So if you put that on a scale of 1/3 the size of the US population, you know, bottom line is we are at an absolute deficiency of testing in this country. I think what we're looking at towards the end of this month, we're close to maybe 5,000 tests. This is what we call mass testing. So this is the initiative to operationalize every ounce of infrastructure that is capable of doing this type of testing in the country. And there's also a lot of logistical issues associated with this mass testing initiative. So it's as good as it gets, but it could be significantly improved.
Right.
So if you come back to the question of how much of a percentage of the country, you should be doing at least 10% of the country on a daily basis.
Wow, that's a lot. Is the Philippines close to flattening the curve?
Well, we've seen, I guess, if you look at I go to a website called the World Coronavirus Meter on a daily basis. And if you look at what's happened since we've had this enhanced community quarantine, we've had a reasonable, I guess, pace of increase in infections on a daily basis. It's very hard to understand the level of infection because of the lack of testing. What's probably more important is to follow the death rate. And from most of the scientific feedback from the community, that unless we're below a rate of 10 deaths per day, then we're really still very much at a concerning level. And I think we had 20 deaths reported most recently for the Philippines. So it all comes back to the lack of testing, Pinky, and the lack of contact tracing here.
Right. Finding a cure for the vaccine, when do you think, we're hearing a lot of reports, even worldwide, about a cure possibly coming in the next couple of months or so, tests on antibodies as well. But really, how close are we to finding a vaccine?
Well, I guess the exciting side of that is there is roughly, I think the last time I checked, about 200 research initiatives out there right now. So quite a significant amount of research and development being done. 200 different types of treatments in the pipeline. So that's pretty exciting. Those are broken down into forming categories. Those are vaccines, targeted therapeutic antibodies, antivirals and cell-based therapies. So, you know, we've got the whole world on this. I can't say at all about a time frame for that, other than what the experts are predicting. I'm not as much of a treatment expert, but we're looking at an absolute minimum of a year away until we see any of those treatments come to the market.
Okay.
And when you consider how quickly those will actually get into the pipeline and into manufacturing, it's still going to be a significant amount of time before the general public actually receives those treatments. So we're looking at anywhere from 12 months to 18 months before we see any type of treatments.
Mr. Seitz, what do we need to understand about this virus?
I'm going to come back to testing and contact tracing. That's the most important thing we can do, because while we do that, we also collect information about the virus. So we are still lacking significantly in our understanding of transmission. We're also lacking significantly in our understanding of infection. So until we have that information better characterized by the scientific community, we can't really act on how and to control transmission, and the same thing goes for infection. One of the things I'd like to bring up as a proposal for this country is, yes, the mass testing is a good first initiative, but what we probably need, and we need to really increase our capacity. And so one of the proposals and plans that we're putting forward is not so much mass testing, but large scale testing. And so the ability to do significant amounts of numbers on a daily basis in a highly controlled environment where you can apply stringent SOP, you can monitor the process, you can maintain the process, and you're going to get very good reporting back. So that all will lead to helping to control this problem.
All right, Mr. Jeffrey Seitz, maraming salamat po sa inyo.
Salamat.
And before we go, we'd like to share with you a remarkable artwork by a nurse in Negros Occidental for her fellow frontliners. Kimberly Joy Magbanwa of Valladolid District Hospital used syringes, needles, and paint to create this inspiring image. She also wrote a poem called Inang Bayan to go along with the painting. She's calling on everyone to stay at home, spread the love, and spread hope so that our motherland may soon heal. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.